Good evening, everyone, and welcome to our event this evening. We're so happy that you're here. Tonight, I'm going to be sharing this evening with some of my colleagues from The Ohio State University Wexner Medical Center MS team. You're going to learn more about them over the next hour and a half as we talk about mindfulness-based cognitive interventions, integrative medicine, and MS in the workplace. You'll also hear about exciting research that's taking place here at The Ohio State University Wexner Medical Center for our MS patients. Our goal is for your comprehensive healthcare, and we will work together to help you achieve your goals. So I am a nurse practitioner. Many of you know me. I work in the MS clinic, seeing patients in follow-up and also in the quality of life clinic. So I would love to have you come visit me there. Tonight, I'm going to serve as the moderator for our event. So first, what we're going to do is we're going to go over a few housekeeping notes. I'm going to give you a few instructions on how to interact throughout the webinar. Your mics are going to remain muted and your cameras will be turned off for the duration of the event. This session will be closed captioned and it will be recorded for viewing at a later date. So I really hope that some of you have checked out some of our other webinars if you were not able to attend. We've had some really great events and we're looking forward to a great discussion this evening. So throughout the evening, we may invite you to type questions and answer into the question and answer box, which you will see at the bottom of your screen. Do not make these personal questions. Make them general questions that are available to discuss for the entire group. If you have questions that need to be of a personal nature, you can save those for an office visit with your nurse practitioner or your provider. If you have any questions unanswered, we will get to your questions in written form in the next days following our presentation. At the end of our presentation, we will have a question and answer session with our panelists, and we look forward to that time to interact together. So I'm going to move along now, and I'll introduce our first speaker. It is my pleasure to introduce to you Dr. Stephanie Kell. She is a clinical neuropsychologist, and this is her first time joining our webinar series. She is a graduate of Northwestern University Feinberg School of Medicine, and she completed her fellowship here at The Ohio State University. So we're very excited that we were able to keep her and that she's here for our MS patients, and we are certainly keeping her busy. She works with her patients to better understand and maximize their cognitive, emotional, and functional quality of life issues. So please join me in welcoming Dr. Stephanie Kell. Dr. Kell.
Hi, well, thank you for that nice introduction. I'm going to go ahead and share my screen here. Okay. So I'm really happy to be here tonight and to be able to speak with you all about how this concept of mindfulness can be used in managing some symptoms in MS. I'm relatively new to the team here, so I wanted to start out for a minute and just talk about what it is that I do in clinic as a clinical neuropsychologist. By training, I'm a clinical psychologist, and I have expertise in the brain sciences and in brain behavior relationships. I do a number of things in clinic, but my overall goal when working with individuals is really to look for ways in which we can maximize brain health and overall functioning and quality of life. A lot of what I do focuses on what I consider to be the invisible symptoms in MS. And what I mean by that are those symptoms that are not always apparent to those around us, to the public. They may not be well understood by the other people in our lives, but certainly for the person experiencing those symptoms, they can be quite meaningful and quite impactful. One of those invisible symptoms can be cognitive change. So research has shown that between 43 and 70% of patients with MS report some degree of cognitive difficulty. And that can look different across different individuals. Some folks report problems sustaining their attention. Others have day-to-day forgetfulness. We know that MS affects this white matter area of our brain, which are these fibers that form like the highways connecting important parts of our brain. And so sometimes when these highways are damaged,
Dr. Kell, we're actually having trouble seeing your slides.
Okay.
It says that you're sharing your screen, but it's like just in that holding pattern.
Okay, let me try and do it again. Is that better?
Perfect. Yeah.
You see it now?
Thank you.
Okay. Okay. So sometimes when we have damage to these white matter tracts or the highways part of our brain, we can see a general slowing, cognitive inefficiency. Information becomes more effortful and slower to process. And for a lot of folks, that looks like a sort of overall cognitive or brain fog. Important invisible symptoms in MS are depression and anxiety. So we know that individuals who experience MS really have a unique set of challenges. You know, living with the disease can certainly be very stressful. And unfortunately, we know that stress can really exacerbate MS symptoms, which can affect our mood and lead to anxiety as well. And then there can also be more disease-specific or biologic reasons why individuals with MS might experience emotional changes. But regardless, we know that the prevalence of depression is like 30% and anxiety is closer to 20%, but both of those are quite higher than the overall population average. And then a final invisible symptom in MS is fatigue. And I shouldn't have saved this one till the end because it's actually the most common symptom in MS. In some studies, up to 95% of patients have reported some degree of fatigue. And for a lot of individuals, this can actually be one of the most debilitating symptoms that they deal with. I really like this metaphor of thinking about our mental energy or our sort of cognitive resources as a battery or a gas tank. You know, at the beginning of a day, we all only have so much gas in our tank. And unfortunately, MS a lot of times just takes right off the bat a lot of that energy out of our tank. And so we're left with sort of really limited mental and cognitive resources that we're challenged with figuring out, how do I divvy these out over the course of a day in a way that's sustainable and allows me to really focus and accomplish the things that matter. This is where I think the concept of mindfulness can come in and be really relevant. So in the last few years, mindfulness has gotten a lot of research and popular attention. There are actually several different evidence-based ways in which mindfulness can be used to treat things like depression, anxiety, chronic pain, other behavioral health problems. And a lot of us, when we think about the term mindfulness, what pops in our brain are images like this of people, you know, meditating in this Zen state here. And that can be an important way of practicing mindfulness is through formal meditation. But the definition of mindfulness, when it was initially started to be researched in the 70s, it was defined as simply paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. And so paying attention in the present moment without judgment. So that habit of being able to, in a kind way, simply observe what we're feeling, what we're thinking, what physical sensations are happening in our body in the moment, I think can be really powerful in MS in particular, because MS has a way of really drawing our thoughts and our attention in a lot of ways to the past. It leads us to think about what life was like before we were diagnosed, or sometimes what has been lost. We also know that living with MS means living with a lot of uncertainty. And so that can really draw our thoughts more towards the future. We're thinking about what could be, what life could look like, what might happen. And so thinking about the past and the future is important, but we don't really want to give those things more attention than they deserve. So being able to, in an intentional way, bring our focus to the present and to doing things that matter, I think can be really relevant in living with a disease like MS. So what does living mindfully actually look like? In Buddhist monasteries, they actually use chimes and these bells that ring throughout the day. And it reminds individuals that no matter what they're doing, to be present and to be focused in the present moment. And so I think that's a principle that can be applied to our day-to-day life. Maybe not with chimes and bells like this, but we all have cell phones. A lot of us have watches that we wear. And so implementing systems where we're scheduling in times and reminders, regular alarms throughout the day that go off and serve as a reminder for us to engage in some informal mindfulness practice, an opportunity for us to really recenter our focus into the present moment can be helpful. And that can be another opportunity where that alarm goes off and we check in with ourselves and ask, am I using my limited resources in the ways that are important? Am I, being strategic in the way that I'm expending my limited mental energy right now? And one area where this can be particularly useful is in managing cognitive fatigue. So individuals who experience cognitive fatigue oftentimes get into this cycle where when they happen to have a good day, they really push themselves quite a bit. They want to be productive and get as much accomplished as they can while they're having a good day. And they tend to overdo it. And then that can actually really exacerbate fatigue and make things quite worse and lead to needing days afterwards to recharge and refill that gas tank. And then, which leads then to just sort of waiting until the next good day happens to come. And then oftentimes on those good days, there's this tendency to overdo it and then exacerbate fatigue and so on. So by incorporating—
Dr. Kell, I apologize for interrupting. It looks like the slides aren't advancing.
Oh, okay.
Yeah, right now we're seeing the presentation in the PowerPoint and invisible symptoms, cognitive changes.
Oh, okay.
Slide.
Huh. Yeah, because it's advancing on my screen. It's not changing now? I'm just scrolling through. It looks like it's still not changing.
It's not, no.
Okay. Why don't
try resharing it?
Yeah.
Yeah.
Okay. Are you able to see that now? This living mindfully slide?
Yes.
Okay.
Yes.
Okay. Okay. And so this is that cycle that I was just referring to, where there can be this tendency when we experience cognitive fatigue to sort of overdo it on the good days and then exacerbate fatigue. And then we require maybe days of rest afterwards to recharge our battery. And then we have this tendency to maybe overdo it again. And so with incorporating mindfulness and informal mindfulness practices into our daily life, we can really develop this more balanced sort of way where we're engaging in doing the things that matter to us and then scheduling in a time to rest and to recharge our battery and then to re-engage and do the things that are important to us and then recharge our battery. And so in this way, we can engage in a pattern of activity that's a little bit more sustainable and more focused on using our limited resources in the ways that are most important to us. And so this is a lot of the work that I do with individuals in behavioral health treatment. A lot of what I do looks like just psychotherapy or one-on-one talk therapy. And research shows that that can really be effective in addressing many of the symptoms that patients with MS experience. It really focused on learning new coping strategies and ways of managing these symptoms. And those can include things like depression, anxiety, overall just adjusting to and coping with the diagnosis, but also fatigue, sleep problems, chronic pain, cognitive changes can all be really effectively managed with behavioral health interventions. And so this brings me to my last slide here. Hopefully that was a useful, very quick overview of mindfulness. But if you're interested in learning more, there's a couple of websites here, mindfulness-based cognitive therapy and A Mindful Way Through Anxiety. These websites are really have some good resources and ways of describing how to incorporate mindfulness into day-to-day life. And then, of course, the MS Society and MS Foundations are always good resources for information. So with that, I thank you, and I'll pass it back to Kristi, and I'll look forward to answering some questions towards the end.
Thank you so much, Dr. Kell. That was wonderful. I feel like I'm taking notes for myself. So it's always great to see you in clinic and chat with things about you in clinic. So thank you for speaking with everyone tonight.
Sure.
All right, everybody. So remember that you're going to want to think about questions that you might have for Dr. Kell. And what we're going to do is during our Q&A sessions, she will be addressing those questions. So go ahead and put those in. And now I am very excited to invite and introduce another first-time speaker for our education events, Dr. Marcus Williams. We're very excited to have him tonight. He is the Associate Director of the Center of Integrative Medicine here at The Ohio State University Medical Center. Marcus Williams is a former Ohio State football player, so some of you out there may know him. And he really developed a special interest in the influence of lifestyle on both performance and health during his time as a player. This led him to a passionate professional pursuit aimed at equipping individuals with the tools they need to transform the way they pursue peak performance and experience the whole person health. So we look very forward to his talk tonight, and he's going to tell us a little bit more about the Center for Integrative Medicine. Dr. Williams.
Hello, that was probably the best introduction I've ever got. I love that. I'm gonna have to keep you on the team, Kristi. That was amazing. So I'm gonna
Happy
share my
to
screen.
do it.
Let's see. Should be good. If for some reason these slides aren't advancing, please just interrupt me. We'll make it happen. But thank you so much. And yeah, if any of you guys know me from playing football, you are diehard fans. I played, I was there, but I was one of the obscure ones on special teams. So kudos to you. If you remember me, that's phenomenal. You're a diehard Buckeye. And as she said, I'm here actually as a replacement for Dr. Klatt. She was not able to make it. So you guys came to see her. Hopefully I don't disappoint you, but very excited about what we're doing over at Integrative Medicine and excited just to share some of the opportunities for you guys to experience a little better health with some of the services that we have. And we always like to start off with the center's mission and vision because it's important to us, because Mariana, when she took over as director for the center in July and then brought me over shortly after, you know, the big thing for her was she wanted to really transform the way the clinic was being utilized, the services were being promoted. What we found was we weren't being used to our full potential. The center was being used kind of as a last ditch approach to people's health needs. And we thought, you know what, like people need to understand that these services can happen alongside your journey, and they're really independent of diagnosis. You know, these are things that can be restorative, preventative, or curative. And that's why we're actually in the process. I know as I got introduced, and you may see on some of the slides, it says the Center for Integrative Medicine. but we're actually in the process of changing our name to the Center for Integrative Health, because we want people to really appreciate the difference between, medicine and health. A lot of time medicine is something you go to when you're sick, and that's fine and that's appropriate. It's very needed, but health is something that you can have whenever, regardless of diagnosis, regardless of your circumstances. It's a state of being, and it's not necessarily a trait. And we're trying to introduce people into that mentality so we can walk this health journey with them and allow them just in those moments when it could be, a really tough moment from a physiological standpoint, but spiritually, mentally, socially, you can be really healthy, the healthiest you've ever been in your life. So that's the paradigm shift that we're hoping to introduce to this community and really the community as a whole as we start to push forward with our integrative health services. Right now, we are one location. We're off Kinney Road, and within that location, we pack it out like a clown car, man. We really, of the 10,000 square foot we have there, we have over 20 providers, 9 different modalities. We have our physicians that we have practice osteopathic manipulative medicine, lifestyle medicine, integrative medicine, functional medicine. We have a doctor that practices Ayurveda. We have a couple chiropractors. We have acupuncturists. We have a few dietitians, clinical psychologists, and we have 10 massage therapists. We're looking to add service lines like physical therapy, and we're excited that in the future, we're going to be expanding geographically. So we'll have a location in the heart of Upper Arlington, hoping to have a location over in Hilliard, and then possibly even expand a little further than that over the next couple of years. So we really want to make sure that these services are as accessible as possible. But in the meantime, if you're looking to just hear more about our services or curious, the best place to go is our website. And then also just to call the office, the 614-293-9777 is a good starting point. You'll get in touch with someone that can kind of talk you through the different modalities, kind of what they mean and how they can best be utilized to get you feeling your best. And then along those lines, we talked about the clinical services, but we also have community classes. And since the beginning of this calendar year, we've been looking to grow and evolve those over each quarter. So right now, here's just a quick snippet of some of the different things we have, from Tai Chi, Qigong, Urban Zen. We have kind of the basics of yoga. We got the gentle hatha, and then we got just understanding the props and what they are, when to use them, how to best implement them into your practice. And then we also have some mindfulness and meditation classes, and classes that are really just for what we call it's empathy. It's just a way to come and we can listen and you to talk with peers and just relate in a way that is good for the soul. And anything that's good for the soul, I think we all can appreciate it, is going to be good for your health. And as we say here, we're constantly creating more. So if you look at this list and there's something that piques your interest, but is there something more specific to the needs you have? If you have those needs, we can promise you that in the greater Columbus area, Central Ohio, there's certainly going to be other people that have those same needs. So we want to create an environment where we can just continue to serve you all in the best way possible. And then specifically, as we just want to, look at MS and some of the things in the literature that are out there that kind of speak to the services we have from a complementary and alternative approach. And I know a lot of you guys probably wondering, is there any evidence out there that supports this? And yes, there is. There is a lot of solid evidence that shows that a lot of the modalities that we have at Integrative Health are very appropriate and very effective in mitigating some of the symptoms that can come along with a diagnosis like MS. And as we kind of go through here, we'll highlight a few of them, but I think it's good to know that the things we're doing, while they may be a little different than traditional medicine, we certainly are rooted in evidence. And I know that that's important to a lot of people. They want to make sure what they're doing is going to be, there's somewhat assurance that it's relevant. They're not just, throwing dust in the wind. And then we actually, to piggyback off Dr. Kell there, Dr. Klatt she's also a student teacher of mindfulness. She's been doing it for, decades plus. And she actually years ago did a feasibility study regarding her 8-week mindfulness intervention called Mindfulness in Motion. And they had 22 participants. That kind of was a nice spread of the different types of MS. And they put that group through the 8-week study and came out the other side. And we saw significant improvements and benefits in several things, from physical functioning to overall mental health to some of the more formal cognitive and psychosocial subscales. We saw improvements, and then just the general sense of awareness and being non-judgmental and non-reactive. Like those are what Dr. Kell talked about, those invisible signs and symptoms. Those are the things that these type of services can help you address. And then we just look at some of the basic things. We talk about exercise, and I know just for me personally, when anytime you want to engage in something that may be outside of your comfort zone or your knowledge set, it's good to know that someone can help you in that, has an understanding of your specific needs, but then also the effectiveness of the modality in general. And I think that's what I want to communicate to this group is, I know a lot of you guys probably are already active or looking to be active or want to be more active. And sometimes there's a hesitation because you don't want to do something that could ultimately be detrimental. Like you don't want to go too hard in a class and then overexert yourself and then have some unintended consequences from that. So that's where we really get excited about our team, is that we do have a group of experts that are very knowledgeable in the sense of how can we appropriately apply these modalities in a way that's going to serve you well and kind of help you find your state of health as you continue to just live life and find that nice, healthy lifestyle. And specifically, there's some research around Tai Chi that demonstrates that it can improve, again, a bunch of these buzzword, hot topic things that I think we all want more of. We want social functioning, pain and health distress, emotional well-being, energy, physical and mental health scores. Like those are important to everybody. Those are universal things. And when we see these modalities that are very effective in improving that, it should just spark your curiosity and say, hey, man, is this something that I would like to add into my life, not just to improve upon a condition that I think is not optimal, but just to make things in general better. It's always like, how can we push it a little bit to get a little bit better than where we are? And I talked about some of our providers. They practice osteopathic manipulative medicine. And here was another study that showed that 2 MS patients, this was based out of Italy. They did a study, it was a month long, and a lot of them had chronic symptoms and some of the pain associated with MS, and they went through a very specific protocol. And again, when we come out the other side after just a week after the final session, like the majority of the group showed significant decreases in fatigue, depression, and an improvement in quality of life. Again, it just shows that there's so much value in exploring the body and touch and how the interrelatedness between pain from a mental standpoint, from a physical standpoint, there's just a lot that goes into it. And I think it just benefits us all to stay curious about that and know that regardless of what we have going on, there's an opportunity to feel a little bit better in any given moment. Again, here's just another study that looked at 2 techniques in particular, the thoracic inlet myofascial release and the sacral wobble. And again, showed that not only were these techniques effective, but they were safe in improving range of motion and helping just overall functionality. And then we mentioned our Ayurvedic medicine, and Dr. Sharma, he said that, in his experience, when he's worked with MS patients, he's seen that a lot of times there can be a root cause of body energy disorders. And a lot of the things that he does, from supplementation to spontaneous meditation practices to breathing exercises, is centered around kind of aligning that energy and helping folks just get optimal bang for their buck. You know, we all have different things that are going to clog the runways per se. And I think it's just good to appreciate the flow of energy and what that means, regardless of if you would quote unquote say you're sick or not. Like, optimal energy is something that can be had by all of us and should be explored by all of us. Again, that was just a few things, but here's a link if you guys are curious to kind of see where some of these alternative and complementary therapeutics and what the research is and what they're effective for. You can go right here to this site and just log in and explore away. And I think you'll be shocked at how much literature is out there and how much time people have spent kind of looking into ways to just make life better for us all. Stop sharing here and I'll pass it back off to Kristi. Thank you so much.
Thank you so much, Dr. Williams. Go Bucks. Hey, I'm excited. I'm ready to sign up. I'm coming over to Integrative Medicine.
Love it. Let's do it.
All right. So I just want to let you guys know that we do collaborate very closely with Integrative Medicine, and we do refer a lot to their centers. So you might get a referral out of the Quality of Life Clinic from your neuropsychologist or from your attending physician. So if you're interested, please let us know, and we're happy to make that referral. So I'm excited to move on to our next speaker. I'm going to be introducing Dr. Zhang. He's a neurologist and he is a fellowship trained neuroimmunologist. And we're so happy to have him here at The Ohio State University. He is one of our fabulous attending physicians, and he's also a researcher here at The Ohio State University. His area of research is focused on aging in MS and how clinical and molecular changes related to aging affect disease progression. The goal of his research is to use evidence-based treatment strategies incorporated with an individual's aging biology to improve the care of people with MS and optimize their quality of life. Speak in my language. So I'm very happy to introduce Dr. Zhang. Dr. Zhang?
Hi, good evening, everyone. Can you guys hear me okay? All right, let me go ahead and share my screen. So, see here. Okay, can anyone not see the PowerPoint slides?
We can
So
see.
okay,
We got
great.
it.
So I'll go ahead and move on. So today I'll be talking about multiple sclerosis and the workplace, which is a topic that we don't often get to visit in the clinic, but it's an important topic, especially for people who are currently working or who are switching jobs or who are considering whether they should get back into the workforce or they have some second doubts about whether or not they should remain in work. So it's an important topic to many of our patients, and I'll touch base on some of the highlights. There we go. So the overview of my talk, I'll touch on 3 topics. And the first one is going to be the most common symptoms related to multiple sclerosis that affect work. And the next topic I'll touch on is the topic of how do you disclose the diagnosis of having MS in the work environment. And then lastly, I'll briefly mention about some job accommodations that are reasonable to request and things that patients can be aware of that are, can really improve their work environment that their employer should be able to provide them if needed. All right, so talking about how MS can affect work, and there are many symptoms that patients often experience, and these are ranging from fatigue to cognitive issues to just kind of downright disability, weakness, numbness, and other gait impairments that often affect one's ability to work. And for fatigue, it's one of the biggest issues in MS. Most patients actually have fatigue. It can leave them feeling really exhausted and make it difficult to get through the workday. I'll touch on that briefly in a moment to kind of mention some strategies that patients can adapt to use to cope with fatigue during the day. And cognitive issues is another prevalent symptom that many patients complain about. And this makes it very difficult to concentrate and focus on the task at hand. And oftentimes, you may have symptoms of forgetfulness or memory loss, where it's difficult to remember something that was just told to you. And we can talk briefly about strategies on how to mitigate that. And then, it brings us down to the more physical symptoms of MS, which deals with the relapses and the progression of disability. These are obvious, symptoms that can limit someone's mobility or their walking ability, their function, and just being able to show up to work. So we'll touch briefly on these topics, starting with fatigue. So fatigue is one of the most common symptoms, and it can make work very difficult. And one of the things that we can offer as providers, there are several medications that can treat fatigue. However, this has not really been shown to be effective for everyone. And in fact, there was a large clinical trial that was published just last year examining the 3 most common MS medications that are used in fatigue. And some of you guys may be familiar with some of these medications. They're modafinil, methylphenidate, and also amantadine. And the trial looked at these 3 medications compared to placebo, and they had the patients take each of these medications for about 6 weeks, and they're kind of in a different order. So the patients go through all 4 medications in a predetermined order. They don't know which one they're getting. And it turns out that all of these medications are no more effective than reducing fatigue compared to placebo for the average patient. Now, some people may respond to one or the other, but overall, the medications for fatigue and MS are not universally effective for everyone. So then we have to look at what we can do to modify fatigue or help mitigate fatigue in terms of kind of environmental changes or behavioral changes or things like that. And that can include some simple things like keeping the workplace temperature cool. And no matter where you work, there should be air conditioning, especially if you have MS. And we all know that MS can worsen with heat, and that can slow down the signal conduction of your nerves. So keeping the workplace cool is essential to maintaining optimal function and reducing fatigue. Other things that you can do is making sure that the office furniture is comfortable, making sure that you wear comfortable clothing. Being in something that's restrictive for a whole day can definitely make you more tired by the end of the day. And one of the things I like to tell my patients when they see me in clinic is that sleep is very important. It's important to make sure that sleep is optimized. And this includes being able to fall asleep when you get onto bed, stay asleep, and also wake up not too early in the morning unless you have to. And there's many issues that can cause someone to have disrupted sleep. And sleep is also something that can be affected in MS. We don't have time to talk about it in detail today, but it's something that you can definitely bring up in the clinic to let your provider know that your sleep has been affected. And then we can talk about ways on how we can improve your sleep. And while you're in work, there's ways you can kind of get through the day easier by taking breaks and focusing more on doing the important things early in the day, because for many patients, their fatigue is worse at the end of the day. So doing some of the more important tasks early in the day can be helpful. And lastly, it's always important to stay hydrated, and it's just good practice in general to avoid caffeine in the afternoons. Cognition is another big issue that can be encountered by many patients at work, and this actually impacts many people's decision to leave the workplace just because they or their coworkers have noticed that they're not really being able to keep up with the tasks at hand. And MS is notorious for affecting cognition. It can cause short-term memory loss. It can change the speed at which you process information. It can also impair attention and concentration, lead to various issues with planning and executive functions, also cause word finding difficulties and so on. And this may seem like a lot, but there are ways which you can mitigate some of these effects. And one of the best things to do in the work environment is to take notes and make sure that the things that are being told to you can be easily remembered. And this can include making a list or keeping things on a calendar, just so that there's other ways that can help you remind yourself of what's what's going on at work, instead of having to rely on your memory to remember everything that's been going on. Now, there's a few other things you can do, such as focusing on a single task or just a few tasks and not being overwhelmed by doing multiple things at once, because if MS affects processing speed or concentration, for example, it may be difficult to focus on multiple things at hand. And if you have any issues with these specific tasks, it's always important to talk to your provider and bring up these issues in clinic. And it may not seem like we have medications or very readily available methods to intervene. There are things that we can actually do to help. And one of the important things that we can do is to schedule a formal cognitive evaluation. And this is it's usually a 2-hour-long assessment performed at OSU by one of our neuropsychologists. And what this test does and why it's helpful is that it identifies all the areas in which cognition may be affected. So looking at things like memory, attention, concentration, word finding, executive functioning, and all these things. And the neuropsychologist will be able to perform a set of kind of tests for you and then figure out which areas may be deficient in. And she'll be able to schedule a call or a follow-up meeting to go over these areas that are deficient and then provide some recommendations on how you can kind of optimize your cognition to mitigate some of these effects. So it's also important to establish a baseline if you've not had a neurocognitive test done before, because in the future, it's maybe possible that MS can affect memory. Not everyone is affected, but it may be possible. And even with aging, your memory can be affected. So it's always good to have a baseline cognitive assessment. That way, in the future, if you begin to notice any changes, then we can always repeat the test again and then see if there's any changes compared to your previous test. So if you haven't discussed doing a cognitive evaluation with your provider, it's something that I can recommend that you talk about. And then just some of the health benefits of working, it kind of goes without saying there are, not only physical, but also mental and also social benefits to being in the workforce. And this kind of, includes things like sustaining your cognition, being at work, it gives you things to think about, gives you tasks to do. It does keep your mind more active, and also it lets you engage in physical activity of some sort, even if it's an office job, just to commute to work and walking to the building, going upstairs, for example, if that's possible. It's also considered some form of physical activity that's better than leading a more sedentary lifestyle. And work can also build self-esteem, leads to engagement within the community, learning new things, and just overall being kind of more fulfilling in terms of doing something that you feel like you're contributing your time to. If you have any questions about work or what kinds of work may be appropriate for you, you can always talk about this with your provider, and they'll know your at which stage of the disease you're in and how and what your limitations may be, and kind of talk about some of the resources that may be available to refer you to. So one of the resources that I think is important for everyone to know about is with MS is the Americans with Disabilities Act. And the ADA, basically, it's there to kind of prevent discrimination against individuals with disabilities, and MS is definitely covered under the ADA. And even for people who have MS who are stable, meaning that their disease has not had any relapses in the past couple of years, or even had any new lesions, and they're essentially just living their life, having MS still counts as a disability, and you are still covered under the Americans with Disabilities Act. So it's your right to request reasonable job accommodations, and as employers, they should be able to make every effort to provide these reasonable job accommodations. So some of the things that you should know about, and it's important when you're applying for a job, is that employers, they cannot ask you about your disability status prior to offering you a position. They can ask you things like whether or not you're able to perform a certain task in your job, but they cannot straight up ask you to disclose whether or not you have a particular disability. And then once you receive an offer, your employer can ask a little bit more information, but they cannot really revoke your job unless you know, unless the disability that you have is preventing any essential functions from being carried out. And then once you're employed, then the employer, they can request medical information if necessary, but that's only if it's essential for, you know, for the business or for public safety, or they're concerned about something that may be related to, you know, safety in general. So disclosing your diagnosis, and this is a very, very personal choice, and you know, it's entirely up to you. There are some advantages and disadvantages to doing so, and the advantage being that sometimes it's just, you know, easier to get it out and let your coworkers know that this is, you know, my condition, I have MS, and it, you know, makes it easier to not kind of bottling up that diagnosis inside you and trying to hide it from everyone. It's also essential if you're requesting accommodations, because you can't really ask for them from your employer unless they know that you have MS. And then lastly, you can, you know, use this opportunity in a positive way to educate others about MS. It's a very common condition, and you may be surprised that, you know, more people than you know about the disease, who they have heard about it or even know someone who has a condition. So it's not as uncommon as some people may think it is. Now, I've also encountered people who have been reluctant to disclose their diagnosis of MS. And that can be due to either fear or, you know, of being rejected or being isolated at work. And, you know, it depends on the work environment. If you're in a good work environment, it really shouldn't be that way. But I've, you know, had patients in the past where one of them was working in a very competitive company, and he was worried that having his coworkers know about his diagnosis, it may prevent him from, you know, getting promotions down the line if they're concerned about his health in the long run. Some other patients may be concerned for different reasons. They feel like, you know, if they are seen as having a chronic condition, they may be seen as different or seen as even weak. And some people just are, you know, wanting to keep things to themselves, and that's perfectly respectable, just for the sake of privacy. So for each individual, it's a very personal decision. And, you know, if you're ever concerned about whether or not it's appropriate for you to tell your colleagues at work whether you have MS, you can also talk to your provider and kind of get their opinion on what is the kind of best thing to do. So in terms of how you can disclose a diagnosis of MS at the workplace, you know, it's important to just downright let everyone, or let the people that you want to know about what, you know, you have, and as opposed to being overly apologetic about something. And, you know, MS is a condition that affects 1 million people in the United States. It's certainly a common condition. It's it's the #1 cause of non-traumatic disability in young adults. So it's a common and prevalent condition. So you should let your colleagues know, if you choose to, in a brief way that, you know, really doesn't put any guilt or blame on you. You should explain to your colleagues or your boss that, you know, MS can affect some of your work functions, for example, whether it may be fatigue or cognition, or just things that cannot be done because of you having MS. And, you know, you can use that diagnosis to request reasonable accommodations like the ones that I mentioned earlier. But you should, you know, be proactive and positive about the disclosure, because after all, it's an interactive process between you and your employers about, you know, letting them know what you have, letting them know what your needs are, and then for them to also let you know what kind of things they can do to help you out around the workplace. Because after all, kind of under the ADA, you are, you know, protected and also entitled to receive the proper accommodations. So what kind of accommodations can you, you know, request or receive under your job if you tell your employer that you have MS? And this can range from a lot of things. You know, it can start from the basics, like just having modifications to your job responsibilities. For example, some of the more, you know, burdensome tasks involving a lot of, you know, say, a lot of higher work volume, for example, that can be reduced, or even kind of cutting down the hours just to make it so that you don't have to stay for a full 8-hour day, for example. There are some more specific requests that you can request, such as kind of having accessible office furniture. So if you do have a wheelchair, all the offices should be wheelchair friendly. Elevators, for example, ramps, for example, these can definitely be installed and should be installed for you if you have these needs. You can also request for periods of rest during work, because it is important to take breaks. Request for closer parking to your office, or even the ability to work from home, because that's important. If you're working in the comfort of your home, it can definitely make you more productive and less stressful to be working in the office environment, for example. And then knowing kind of when to stay or when to leave the workplace is also important. If you are concerned about your symptoms or other things that are affecting your work, you can talk to your provider. You can consider getting a cognitive study done to see if there's any deficits in your thinking or memory that may impact things. And you can also talk to one of our social workers to determine, what are the resources that are available to you for getting into a job, or even switching a job, or even leaving your workplace, and what can come after that. So some resources that I want to share as my last slide. It's important to go to the National MS Society. In fact, that's kind of the best resource I recommend all of my patients to learn more about MS. And there's actually a specific section at the National MS Society just on MS and employment. It goes over some of the things that I mentioned, and also just gives you more resources on what you can do or what kind of accommodations you can request, for example. And you can learn more about the Americans with Disabilities Act, and also seek other websites, such as the one mentioned below, the Job Accommodations Network, which is a resource provided by the US Department of Labor. It's free. It offers expert services to kind of help you kind of understand or know what kind of accommodations are reasonable for you specifically to request at your work environment. If you have any of these questions related to MS and work, or just steps before work or even after work, you can talk to one of our social workers as well, Sarah, who is located at Outpatient Care Grand Hannah, or Kenzie, who is located at Northern Warehouse. To reach them, you can just call our clinic and ask to be directed to them, or to have one of them give you a call back. So with that, I'm happy to have shared this information with you. I'm happy to answer any questions at the end.
Thank you so much, Dr. Zhang. What a wonderful talk, and a very important subject. I know a lot of our patients have work concerns, and I feel like we could probably do an entire talk just on that alone. So we thank you for sharing. And guys, if you have questions, go ahead and put those in, and we'll address those at the end during our Q&A. And now it's going to be my pleasure to introduce Dr. Teresham Gyang. Dr. Gyang is a clinical warrior here at OSU. She's involved in everything. She's a neurologist and neuroimmunologist, and she's seeing patients in clinic, very busy. She's in charge of a lot of our clinical operations. She does a lot of multidisciplinary clinics with rheumatology, pulmonology, neurosarcoid, neurolupus, and she is managing a lot of the clinical fellowship programs. So often she will have a fellow with her, a physician who's doing a fellowship in neuroimmunology that she's teaching. And she's doing a lot of our clinical trials. So our clinical trials regarding new medications for MS, and as well, you may have heard about her big COVID-19 study. So she's a very busy lady and a clinical warrior, like I said. So it's my pleasure to introduce her. She's going to talk a little bit more about some research that's happening here at The Ohio State University. Dr. Gyang.
Thank you very much, Kristi. And thank you everybody for attending. We're really excited to present these programs to you on a quarterly basis. I'm just going to share my screen. And I mean, I think the talks that came before this were just awesome. Very, very valuable information. And I hope you're all joining us for the Q&A session that's coming up, I think right after this, right after the research update. So Kristi, thank you for that wonderful introduction. I am one of the MS doctors here at OSU, and I'm going to be talking primarily about the current research that's going on, and I'm going to give you ways in which you could, ways to find out how to participate in research if you are interested. So we have a poll question. I'm not sure when the poll question or how the poll question was supposed to come. Oh, there we go. So the poll question should appear on your screens. What type of MS research do you think would be the most impactful to the MS community? So you can only select one option. Discovering newer and simpler ways to diagnose MS, discovering the cause or causes of MS, discovering new interventions that can slow the progression of MS, or discovering ways to maintain the quality of life while living with MS. So we're going to give you a few, maybe 30 seconds to think about your answer and just click your answer on your device. Okay, I think we can move on. I'm not sure if the response is supposed to come up. Oh, there we go. So let's see how we all responded. So most people voted for discovering new interventions that can slow the progression of MS. I think that's a very important question. So far, we don't have a lot of treatments that can do that. So that would be awesome to have, you know, some kind of discovery that could do that. Next, we have discovering the cause or causes of MS, and then discovering ways to maintain a quality of life, and then finally discovering new and simpler ways to diagnose MS. So that's wonderful. All right, so we're going to talk about the different studies that are going on and the different ways that you can participate in research here at OSU. We have a few clinical trials that are currently ongoing. And then we have what we call bench or lab research and translational research as well. So I'm going to be covering these studies today, and Dr. Zhang, who just presented about work on MS, is going to present the last two topics. These are studies that he's working on. So just an overview about clinical research in general. Most of the time, you know, when we talk to patients about clinical research, we're talking about clinical trials, or a lot of times it's other types of research that involves testing, you know, people, or getting blood work or some kind of biospecimen from our patients or from healthy controls. But there's a lot of research that goes on in the lab, or, you know, outside of the clinical space. So there's a lot of interventions and discoveries that come up in the lab, or we call it preclinical, meaning it hasn't even gotten to people yet. And there are ways that, you know, you can contribute to that preclinical research in different ways. And then you can be enrolled in, for instance, a phase 3 trial. We're going to talk about a few phase 3 trials today. So the first, we're talking about the Btk inhibitors, and this is we're currently enrolling in relapsing MS and primary progressive MS, and I'll talk about, you know, we are opening it up to secondary progressive MS very soon. So what is this all about? We have a new compound or new set of drugs that are being investigated in MS. These drugs work by inhibiting a specific enzyme called the Bruton's tyrosine kinase. This is an enzyme that's found in multiple immune cells. For instance, in the B cells, other cells are the myeloid cells or the microglial cells. This is not a completely new type of drug. It's already used for certain types of leukemias, certain types of transplant cases use these drugs. And so we know about the safety profile of these drugs. And the unique thing about these drugs is that they also work on immune cells that are resident in the brain. So a lot of the drugs we have today work on the immune cells outside the brain. In this case, there may be an effect on the immune cells inside the brain. So what are some of the potential benefits? We have a drug that may have direct effect on immune cells called microglia in the brain. And that may have some neuroprotective effects. Most of the drugs we have today, there's not a lot of strong evidence that they directly affect the immune cells in the brain to cause a neuroprotective benefit. The other advantage is this is a drug that is able to penetrate into the blood-brain barrier to exhibit all these effects. There have been preliminary studies of these drugs in MS, both in the preclinical setting, meaning in the lab with mice, using the mouse model of MS, and it was a good positive study. And there have been phase 2 trials that looked at how well these drugs reduced relapses or MRI enhancement in MS patients. And these were very positive studies. And so right now we are currently enrolling for the relapse and remitting MS. It's a blinded study. So it's the Btk inhibitor is a 60 milligram tablet compared to teriflunomide, also known as Aubagio. And the main endpoints we're looking at is the annualized relapse rate. Also enrolling for primary progressive MS. In this case, it's been compared against placebo for primary progressive MS. And we're looking, the endpoints would be the time to onset of 6-month confirmed disability progression. Now, for patients with secondary progressive MS, we are very soon going to start enrolling for patients with secondary progressive MS. And this would be the secondary progressive MS without activity, meaning without relapses. This is the contact information for people that are interested in hearing more about this study. The study coordinator lead, her name is Kasturi, and her name is on the screen with her phone number and her email. You can also discuss with your MS doctor if you want to be considered, if you want to be screened for this study to see if you may be an eligible candidate. And now another study that we have that's ongoing, for those of you that don't know, we have what's called the biorepository. It's the Neuroscience Research Institute Brain Bank and Biorepository. And basically what this is if you come into the clinic and your doctor sees you and you need routine blood work, a lot of you, because of the medications you're on, need to get blood work on a routine basis. Or if you need to get a spinal tap to diagnose MS or for any reason, you can be enrolled in this study. And basically this study is going to ask to take an extra sample. So if you're getting blood work, can we get an extra tube of blood to put in this bank? And these samples are stored and can be used for a lot of research. Basically, we're using them to do research that helps us understand what's going wrong in MS, and not just in MS, but in a host of other neurologic disorders. So, this is a very easy study. Most of you get blood work. If you are interested, there's an email that's listed, or just talk to your doctor the next time you see your doctor and just say, I heard about the study about the biorepository, the brain bank and biorepository. If you are interested, we will enroll you. And while you're getting your routine clinical test, we will get an extra sample of tube of blood for this research. And a little bit about the lab research that's going on. And so, we talked about the fact that we're generating this biorepository to collect samples. A lot of these samples can be used for research in the lab. And this is very helpful when we have these samples. So in Dr. Segal's lab right now, there's a lot of different research, excuse me, that's going on. I know a lot of you answered the question about finding an intervention that helps to slow the progression in MS. So there's a lot of research that's going on. Some of it is targeted towards how do we induce remyelination? How do we slow down the destructive processes that are going on? Very recently, there was a discovery that was made in the lab that discovered a new type of white blood cell that is instrumental in suppressing some of the destructive inflammation that happens in MS. There's also a lot of studies on looking for new biomarkers. Biomarkers just means, is there like a new test we can find to help us determine how well you're doing on your treatment? And so these are just a few of the things going on. There's a lot more going on in that lab. And samples that we collect from patients with MS or other disorders really, really help us in conducting the, research like this to be able to discover new biomarkers or new ways to treat MS. And I will call on Dr. Zhang to talk to us about two exciting studies that he's going to be part of. Dr. Zhang.
Yeah, thanks, Dr. Gyang. So the study that I'm actually recruiting now, and the recruitment just started this week, is a study on biological aging in multiple sclerosis. And basically the premise of the study is to see whether patients with MS have faster rates of biological aging compared to patients without MS. So, what is biological aging? We're all familiar with the concept of chronological age, which is how old we are in number of years. But we all know that not everyone really who is the same age are really indeed the same age. You might see someone on the street who's looks like they're age 50, but they're actually much younger than that, or vice versa. You might see someone who, for example, is a lot older, but actually appear much younger, but actually much older. So basically, the concept of biological aging is that there's a lot of factors that contribute to how our internal systems are aging. And MS is thought to be one of the processes that can drive biological age, since it is a condition that causes chronic inflammation. So what the study does is we're recruiting participants with MS who are adults, and they can have relapsing remitting MS or secondary progressive MS. And what we're interested in doing is to look in the blood and look at some of the various aging biomarkers to see if these markers are more advanced or tell a story of more older age compared to people who don't have MS. And what it's going to entail is in the initial visit, and we'll recruit our participants from the office during the routine clinic visits. And if you see me, I may talk about the research with you. And then if you're interested, then we'll have our coordinator talk about it with you a bit more in consensus. But what it entails is during your clinic visit, we'll do a blood draw. And for many people, this is part of the routine blood draw while you're taking medications, just for monitoring purposes. But this will be a blood draw in addition to checking your regular labs to check specific aging biomarkers. And what we'll also do during your initial visit is to perform a couple of basic neurological tests to look at things like your thinking and memory, your walking speed, your dexterity, for example, and just your overall neurological exam findings. We'll refer you to have a cognitive assessment, and then we'll also analyze your MRI information, and all this will be compared to other participants and participants who have relapsing remitting MS or secondary progressive MS, just to see if your specific profile of aging, for example, is more advanced compared to other individuals with MS. So if you're potentially interested in enrolling in the study, you can definitely send an email to our study coordinators at msresearch@osumc.edu. Or if you're seeing me in clinic, I'm more than happy to talk about the study with you. Or if you have another provider and you're still interested in the study, you can definitely email us and get a hold of one of our coordinators, and we can talk about it over the phone. So the next slide, please. And then the second study, and this one is not enrolling just yet, but it will take place likely during the summer, starting in the summer. So I'm planning a study to look at neuromuscular function in older adults with MS. And the purpose of this study is to kind of figure out what are some of the contributors to older adults with MS exhibiting more pronounced weakness. We know that as we get older, many healthy older adults start to notice weakness, and this is even more so in patients with MS. So as providers, we don't really know what's contributing to that weakness, whether it's entirely driven by the disease itself, or if age plays a role, and how much of that weakness is due to the muscle being weak versus due to the nerves who are not relaying the signal from the brain to the muscles, which is affecting MS. So the study we're going to be recruiting in the summer. So right now it's not up yet, but I just want to plant the seed in some of you who may be interested, is that we'll do some studies, and it's going to take place at Ohio University in Athens, since they have my collaborator there has the lab set up and has the equipment to do these tests, which in the future we may get our own equipment here at OSU. But for the time being, it's a study that's going to be taking place in Athens. So it does involve a bit of a drive if you're not really from more southeast Columbus area. Nevertheless, I think it's an important and also interesting study to find out what are the contributors to muscle weakness in older adults. So I won't tell you too much, since we're still waiting on the IRB approval, just to make sure that they can approve the study before we go ahead and actually recruit patients. But once it is approved, then at the next seminar or the next webinar, we can talk about it. Or if you want to ask me about it in the summer, I'll be happy to talk about it with you.
Thank you very much, Dr. Zhang, for talking about those studies. This is the end of the research update presentation. And as you heard, we have multiple studies going on. So just let us know, send a message to your doctor or send an email to any of the emails listed if you're interested in participating in any of the studies. I will hand this over to Dr. Harrington, I think, or maybe Kristi. Yes. Okay, perfect.
Yeah, thanks so much, Thierry. So we're going to start the Q&A panel now. So if everyone can turn on their screens so we can see all the panelists. So thank you for taking the time out of your day to spend with us. We always look forward to connecting with our current patients and meeting those of you who have yet to begin your journey with us. Next, we'll use our remaining time to answer questions that have been submitted through the Q&A box throughout the evening. So if you haven't submitted any questions that you're thinking about, please take this opportunity to do that now. And we'll answer as many of these as we have time for, and also post the answers to the questions along with other resources after the webinar on the website. So first, I'm going to go to the submitted questions. I wanted to ask Dr. Kell, one of the first questions, can you talk about some ways that people can develop a meditation practice in their daily life?
Sure. Well, a lot of what I talked about tonight was about informal mindfulness practices and ways that can be incorporated in day-to-day life through things like setting an alarm to check in with yourself. But more formal mindfulness practice would be like structured meditation. And there's so many great resources these days just on YouTube of guided meditations. If you're interested in doing ones that are really in-depth and long, that's great. But even like 3-minute or 5-minute meditation, a guided meditation that focuses on breathing or focuses the attention to different areas of the body can be really effective. The important thing is just to get in the practice of doing it on a regular basis.
Great, thank you so much. Let's go to Dr. Zhang for the question about if you're on a working DMT, is it recommended to participate in a clinical trial, and who's the best candidate for clinical trials? Maybe actually we can hear from Dr. Zhang and Dr. Gyang on their thoughts on this.
Well, yeah, I'll go ahead and start with my response to the question. So if you're already taking a particular disease-modifying therapy, for some of these trials, you may not be eligible if they're investigating a new medication. However, if the clinical trial is investigating an intervention that doesn't involve switching off of your disease modifying therapy or some other intervention, then you may be eligible. But at the moment, I'm not aware of any studies at OSU in the latter category.
Yes, I mean, I would add a few words to that. So for the BTK studies, there are patients that maybe are on a DMT and the DMT is not working effectively, or they have a relapse on their DMT. So if you are in that category, absolutely, we can accept you. We can assess to see if if we could start you on a trial, stopping that DMT and starting the new drug trial. And then there are patients with progressive MS that, for instance, have been on ocrelizumab and haven't really seen a benefit and want to try a new drug or a clinical trial intervention. So the trial is also open to patients like that. There may be a washout where we need some time to wash out the effects of your old or the DMT that you're on before you start the new DMT. So for the clinical trials, it depends on what you're on. It depends on your situation. If you're stable, for instance, with relapsing remitting MS and you've not had a relapse in a long time, you may not qualify for the trial. But if you've had a relapse recently, or if you're primary progressive MS, you want to try something different, absolutely. We can look at you and screen you to see if you're available. For the biorepository, anybody is open to participate in that. It doesn't matter if you're on a DMT or not on a DMT. It's a simple collection of blood that we do while you're getting blood work for your routine exams. Thank you.
Great, thank you so much. Dr. Segal, I'm going to pose the EBV question to you. Is there any research on Epstein-Barr virus being part of the cause of MS? And then also, if you want to talk a little bit about kind of on exciting things upcoming in your lab.
Sure, thank you, Dr. Harrington. So there's a lot of research going on about the role of Epstein-Barr virus in multiple sclerosis. Many of you may be aware of a recent article showing that people who are exposed to Epstein-Barr virus as adults are at increasingly higher risks of developing multiple sclerosis within a 5-year time period, suggesting that somehow exposure to this virus does trigger the presentation of multiple sclerosis. However, we really don't know the underlying way it does so, or the underlying mechanism. So many laboratories around the world are looking into this. In fact, I'm sitting on the board of one of the big MS meetings that's conducted every year, a meeting called ACTRIMS, and that's going to be one of the major areas of focus at next year's meeting. Here at Ohio State, we're beginning to collaborate with some experts in Epstein-Barr virus to do our own studies, and that's just getting underway. So we are collecting blood and in some cases spinal fluid from people with multiple sclerosis, and we're going to measure whether they have an immune response to the virus, and in very great detail figure out the type of immune response they may have, as well as looking for evidence of the latent virus in white blood cells, and then correlating that with different symptoms, signs, as well as other ways in which we evaluate MS. So we are beginning to collect blood and if someone's having a lumbar puncture, spinal fluid as well, that is going to be stored for those future studies. With regard to other work that's being done in our laboratory, we are also collecting specimens from people with MS, blood and spinal fluid, to do an array of different biomarker studies to try to develop new tests that will help us predict if someone's going to respond to a particular drug, look for different tests that may help us better characterize someone as relapsing, remitting, or progressive. We also have a whole program using animal models of multiple sclerosis, where we induce MS-like disease in mice to better understand exactly how the immune system damages the nervous system in people with MS, with the long-term goal of developing even better therapies and more targeted therapies that we have now to block the destructive inflammation. I think Dr. Gyang mentioned another exciting line of research that we're doing, which is to identify special types of immune cells that, instead of causing damage in the nervous system, may actually trigger repair. So we have identified in mice, for example, these very immature immune cells. They're stem-like immune cells that actually stimulate damaged nerve fibers to regrow, and also rescue damaged nerve cells from dying. We've done this in mice. This has been published last year. And now we're looking for human counterparts of those mouse cells. And we have some very exciting preliminary data where we think we found some cells actually in human umbilical cord blood that have this, what we call a neuroprotective and neurorestorative effect. So a lot of exciting work going on, both in terms of fundamental studies, working with mice and human cells, as well as more of these biomarker studies, and the exciting work being done by the whole clinical team. Dr. Gyang's studies with the Btk inhibitors, which are very exciting, her continuing studies on the ability of people with MS to respond to the COVID-19 vaccine, Dr. Gyang's studies on biological aging in multiple sclerosis, which I think are also really very innovative and important, because we definitely now appreciate more and more that the age of an individual could really influence the way multiple sclerosis is manifested, and may be one of the important factors determining if someone has relapsing, remitting, or progressive disease. So the better we understand how aging interacts with the disease process, that could even lead to a new generation of drugs that block aging pathways that may contribute to chronic or progressive MS. So a lot of work going on here. I mean, it's really inspiring since I came here almost 3 years ago, to see how the research has really expanded and prospered.
Thank you so much, Dr. Segal. I'm going to pose a little more time for a couple more questions. So for Dr. Zhang, is there a connection between MS and developing other autoimmune disorders? And would some of the DMTs that we use for MS potentially provide a crossover benefit for these conditions? And then I'll also give you the second question, which was about your study. Do patients get to learn the outcome of their tests if they participate in one of your studies?
Okay, so for the first question about MS and associated autoimmune conditions, there's definitely a link. Patients who have MS are slightly more predisposed to having other autoimmune conditions, and we sometimes see that in our patients. And depending on the other condition that they have, there are few overlaps, in which case a medication that's used for multiple sclerosis may be effective for another autoimmune condition. It's rare, but when that happens, we generally choose that drug to kind of tackle two diseases at once. But oftentimes for different conditions, patients end up being on different medications for both, and we of course work with their other specialists to make sure that the drugs are appropriate. For the other question regarding the aging biomarker study, whether or not a patient can learn their individual results, it's not something that we usually do in studies to kind of give out the actual results for each individual test. However, what we can certainly do is to share the overall results of the studies with the patient. And keep in mind, even the results, it's not something that's going to, it may not yield any, I guess, useful information right away, because these aging biomarkers in some ways are very investigational. So being told that, you may be at a, more advanced biological age doesn't mean that, for translating to, you necessarily having higher risks than someone else. So we also don't want to pass along any information that may not be backed by evidence at the moment. So that's why we're doing these studies to be able to provide the evidence going forward, so we can tell patients when these studies are, have made its way into the clinical setting.
Thank you so much. We have a couple more questions. So I think the first one was posed when Dr. Kell, you were giving your presentation. How do you manage some of the chronic daily symptoms of MS while working full time? What are some of the strategies that you may recommend for people? I know you've talked a little bit about energy conservation. Could you elaborate on that as well?
Sure. So one of the biggest things that I recommend to people is finding ways of incorporating regular breaks throughout their workday, moments where they can do some sort of activity that for them is going to be restorative, that's going to kind of give them that little energy recharge. And so that's pretty different for different individuals. For someone that might be, reading a little bit, that wouldn't be mine. But for some individuals, it might be like getting up and stretching or just taking a few minutes to meditate. But whatever it is, to be able to incorporate those little moments throughout the day where you're kind of taking a break, taking a step back from work and doing something that will kind of recharge would be my number one recommendation.
Thank you. And Kristi, sorry, we haven't heard from you in any of the questions, but I wanted to pose you a question about the Integrative Medicine Clinic, because Dr. Williams unfortunately had to go and wasn't able to stay for the panel. But can you tell us a little bit about what experience you've had with patients referring them there and what people have said, or kind of your thoughts about what might be beneficial for a particular person?
Yeah, absolutely. And we do collaborate very closely with them. And we've had several meetings talking about, their services and what they offer, and also their research and their work into treating MS patients. I personally have made a lot of referrals, as I know a lot of team members here that you see have made referrals for things like therapeutic massage, mindfulness. There are some dietary consultations. And many of my patients have been interested in the yoga. And I don't know if you noticed on his slides that they have a lot of different offerings in yoga, which we know there's a lot of evidence that yoga is beneficial for our MS patients. They even have a class that's as simple as breaking down what are the tools to use for yoga. They have different types of yoga, and they talk about yoga, ways that you can practice yoga safely. So modifications for MS patients, and they also have online practices. Some of the other things that our patients have access that I have referred for have been, discussing those dietary things that we talk about in the quality of life clinics, such as anti-inflammatory diets and things of that nature. It's just another layer of diving a bit deeper from some of the things that we talk about in quality of life. So I'm always happy to make that referral. I'm happy to discuss integrative medicine in the quality of life clinic. And I know that all of our other panelists and attending physicians here and providers are more than happy to help you get hooked up with integrative medicine.
Thank you so much. I think we're pretty much out of time for questions. The last one about the trials and whether it's possible to participate if you don't have MS, but have another autoimmune condition, you can certainly participate in the biorepository. So a collection of samples, which we may use in other situations where we need people without MS or sort of kind of pre-diagnosis MS in that type of situation. So I would encourage anyone who's interested in participating in research to think about donating blood, or if you're getting a spinal fluid. So I'll put you back to Kristi, and I think you can wrap up our conversation for today. Thank you.
Thank you, everyone. And thank you to all of our speakers and panelists and everyone who attended. It's always great to spend time with you guys. And I want to encourage you, if you missed any of our other talks, to go ahead and go to our website, which is www.wexnermedical.osu.edu/MS community. And that is where you can find all of our recorded talks, including this one. And for those questions that we did not have time to get to, we will answer those in writing, and you'll be able to find those as well. And if we could go back to the previous slide, I just wanted to highlight just for a second our entire team. And this is not everybody, but this is a large group and some of the people that you saw tonight. We are a very collaborative program here at Ohio State University Wexner Medical Center, and we all work together to achieve the best outcomes for our patients. So again, we want to thank you for joining us tonight, and we look forward to having another event with you guys. So look forward for those invites from your providers. And if you would need an appointment, if you would like to come and see us, this is how you get an appointment. To schedule an appointment online, you're going to again visit wexnermedical.osu.edu/appointments. And you may seek a referral from your primary care physician, or you can call our office in order to get scheduled with the OSU MC/MS care team. So those phone numbers for a neurologist or a clinic appointment, 614-293-4969 or 614-482-2076. Outpatient rehab, if you need an appointment with our physical therapy team, you're going to call the Martha Morehouse Pavilion at 614-293-4523. Again, thank you so much for joining us, and we appreciate your time. Have a wonderful evening, and we'll see you next time. Take care.